In this section, I'll talk about medications commonly used to treat panic disorder and agoraphobia, which are the antidepressants and the benzodiazepines. I'll also touch on another class of medications that may be used, which are called anticonvulsants. Before I start, I want to be very clear that I'm not a medical doctor, and what I'm saying should not be considered in any way to be medical advice or treatment. It's the job of the treating physician to determine the best treatment for the patient. With that said, I want to give you an overview of the role of medication in the treatment of panic disorder and agoraphobia, and address some questions that frequently come up. First, let's start with the antidepressants, which are commonly prescribed for panic disorder and agoraphobia. Antidepressant medications, which were initially developed to treat depression, are effective for anxiety and are often viewed as a first choice of medication treatment. These medications work by affecting chemical messengers in the brain that regulate anxiety and mood. These chemical messengers are called neurotransmitters. Antidepressants work by increasing the neurotransmitters serotonin, norepinephrine, and/or dopamine. While I'm going to mention many different antidepressant medications, the evidence for their effectiveness in treating panic disorder and agoraphobia does vary. You should discuss medication choices with your doctor. Also, one thing to note is that prescription drugs go by two names, their brand name and their generic name. In the upcoming slides, we'll first list the brand name and then the generic name in parentheses. There are 5 different classes of antidepressant medications, which I'll briefly review. The first class are the serotonin reuptake inhibitors. This group includes the selective serotonin reuptake inhibitors, or SSRIs, which are the most commonly prescribed antidepressants because they have relatively few side effects. SSRIs increase the level of serotonin in the brain. Serotonin modulators are newer drugs that act like SSRIs, but also affect other serotonin receptors. The second class of antidepressants are the serotonin and norepinephrine reuptake inhibitors, or SNRIs. SNRIs are similar to SSRIs in that they increase levels of serotonin in the brain, but they also increase norepinephrine in the brain to improve mood. The next class are the atypical antidepressants. In addition to targeting serotonin and/or norepinephrine, atypical antidepressants may also target dopamine. The fourth class includes the tricyclics and the tetracyclics. This is an older class of antidepressants that also work by increasing levels of serotonin and norepinephrine in the brain. These medications are good alternatives if the newer medications I went over are not effective. The last class of antidepressants are an older class called the monoamine oxidase inhibitors, or MAOIs. Monoamine oxidase is an enzyme that breaks down the brain chemicals serotonin, norepinephrine, and dopamine. The MAOIs work by blocking this enzyme. Although these medications can be very effective, they're not frequently used because of the need to follow a special diet to avoid potential side effects. How long do antidepressants take to work? Antidepressants must be taken as prescribed for 3 to 4 weeks before you can expect to see positive changes in your symptoms. So don't stop taking your antidepressant medication because you think it's not working. Give it time. What if my antidepressant doesn't work? Sometimes the medication you first try may not lead to improvement in symptoms. You and your doctor have a lot of choices of medications, and it's hard to know which one may work best for you. This is because each person's brain chemistry is unique, so what works well for one person may not do as well for another. Be open to trying another medication or combination of medications in order to find a good fit. Let your doctor know if your symptoms have not improved. And most importantly, do not give up searching for the right medication. Can I stop taking my antidepressant? It's typical for treatment with antidepressant medication to continue for 6 to 9 months. Discontinuing treatment earlier may lead to a relapse of symptoms. If you have a more severe case of panic disorder and/or agoraphobia, your doctor might recommend longer-term treatment. To prevent symptoms from coming back or worsening, do not abruptly stop taking your antidepressant medications, even if you are feeling better. Stopping your medication can cause a relapse. Medication should only be stopped under your doctor's supervision. If you want to stop taking your medication, talk to your doctor about how to correctly stop it. Do antidepressants cause side effects? Some people who start medications express concerns about side effects. All medications may cause side effects, but many people have no side effects or minor side effects. With antidepressants, the side effects people typically experience are tolerable and subside in a few days. You can always contact your doctor or refer to the patient information leaflet that comes with your medication if you have questions about side effects. In rare cases, these medications can cause severe side effects. Contact your doctor immediately if you experience one or more severe symptoms. Next, let's discuss the benzodiazepines, which are a different class of medications than the antidepressants. Benzodiazepines work by enhancing the effects of the neurotransmitter GABA, which has a calming effect. Here are the benzodiazepines most commonly prescribed for panic disorder and/or agoraphobia. They include Ativan, Klonopin, and Xanax. A reminder that we first list the brand name and the generic name is in parentheses. How long do benzodiazepines take to work? Unlike the antidepressant medications, users of benzodiazepines can feel the effects quite quickly, sometimes in less than 30 minutes. The effects can last for several hours, up to a day, depending on what medication is being taken. How frequently are benzodiazepines taken? Benzodiazepines can be taken on an as-needed basis or might be prescribed to be taken on a regular schedule. While benzodiazepines can be effective in the short term, for most people, they're not the best long-term treatment strategy. Some doctors might prescribe a benzodiazepine just as a person is getting started on an antidepressant. Use of an antidepressant is usually a better long-term medication management strategy than benzodiazepines. Therefore, the doctor might taper off the benzodiazepine once the benefits of the antidepressant kick in. What are some concerns about benzodiazepines? In general, the use of benzodiazepines on an as-needed basis should be avoided. One of the goals of psychotherapy for panic disorder, especially CBT, is for you to learn that while panic attacks are uncomfortable and unpleasant, they're not dangerous and can be tolerated. Becoming less fearful of the panic attack is key in recovering from panic disorder. When you take a benzodiazepine on an as-needed basis, such as when you have a panic attack or you're feeling increased anxiety, you're depriving yourself the chance to learn that panic attacks are not dangerous. In fact, you're giving yourself the opposite message. I can't tolerate this, so I must take a medication immediately. Same can be said for agoraphobia. If you take a medication before entering a feared situation, it makes it harder for you to learn that you can approach these situations without medication. Also, for those taking benzodiazepines, it's important to be aware that these medications may be habit-forming. Those who take benzodiazepines on a regular basis are at risk for dependency and withdrawal. People might need to increase the dosage of their medication in order to get the desired effect. They may also experience symptoms of withdrawal when coming off the medication. So if you are taking these medications regularly, only stop under the supervision of a doctor. It's important to note that because of these addictive properties, benzodiazepines might not be prescribed to people with a history of substance abuse problems. Do benzodiazepines cause side effects? Benzodiazepines can cause drowsiness, impair coordination and concentration, and reduce short-term memory. They should not be used at the same time as alcohol or opiate medications. Finally, as I mentioned earlier, some people are prescribed other medication for panic disorder and/or agoraphobia, such as anticonvulsants. Anticonvulsant medications are usually used to treat seizures, but they also help control mood and anxiety. They are generally used with people who do not respond to a trial of antidepressants. Anticonvulsants are believed to work by increasing the neurotransmitter GABA, which has a calming effect on the brain. It's also believed that they decrease glutamate, which is an excitatory neurotransmitter. Okay, that wraps up our discussion of medication treatment for panic disorder and agoraphobia. Join me next time to talk about how family members can help their relative with panic disorder and/or agoraphobia.